Welcome to the On Your Mind podcast, where we are changing the mental health narrative, bringing hope and solutions. Here's your host, Timothy J. Hayes, psychologist.
Dr. Alan Lewis, MD, has over 30 years of medical practice experience using both traditional and integrative medicine approaches. He is the founder of the Sancta Familia Center for Integrative Medicine in 2011 in Columbus, Ohio. There, he specializes in treating children and adults with learning, mood, developmental, behavioral, and immune infectious disorders, including autism spectrum disorder, attention deficit disorder with and without hyperactivity, PANDAS, and Lyme disease. Dr. Lewis was also recently named the clinical director for the Advanced Brain Technologies, founders and creators of the Listening Program. Well, Dr. Lewis, thank you so much for joining us here today. It's a pleasure to meet you.
Thank you very much for having me. I'm glad to be here.
I was hoping you could start us off by telling us a little bit about how you got started in the work, is a specific work you're doing, and what drives your passion for it.
Oh, sure. Thanks. Well, it's interesting. When I went to med school, I knew I wanted to be a doctor, but I really didn't know I wanted to be a pediatrician until it was time to do my residency training. But when I looked back, everything that I had written for application to med school and things really showed that I really did want to do pediatrics. So really, it was wanting to help children and families. And I did general practice for about 8 years before my son was diagnosed with autism. And at that point, things changed. We were told at that time, he's 22 now, but we were told that there's really not a lot that could be done. And, we would just expect that he wasn't going to develop normally. And that same day he was diagnosed, thankfully, the National Institutes of Health came out with their report on educating children with autism, and they described the success doing applied behavioral analysis with Lovaas training. And I was kind of left with, what do I do to help that work better? Because we had been told that, the autistic symptoms were present because of the diagnosis. But what I've come to learn to understand is, and this is the way I look at any patient now, is, they have a biologically impaired brain, or they have some biology that's, off kilter that we need to find and need to address. So my real goal now is anybody that comes to me, especially the kids, is trying to find what's impairing their ability to develop normally. We want them to be optimally well in life and development. So over now 20 some years and doing integrative functional medicine, I've found a number of things that can be really helpful to help what was thought to be unable to be treated.
And the kinds of factors I'm assuming that you're talking about that might be preventing them from developing optimally are not just that they're missing certain medications in the psychotropic realm.
No. At some point, tongue in cheek, you can say that depression isn't Prozac deficiency, but
yes.
Let's just be real, it's having a physiologic effect on the brain. So what was wrong with the brain potentially, and or other things that the medicine potentially could help? And can we do that another way? And so that's really the way I look at it is, what is the body crying out for that it needs, and when it comes to a natural substance. And in the journey, there's just so many things to cover. But, the thing that was kind of the unifying theme for me and helped me go from, that interventional pharmaceutical kind of paradigm to more the integrative functional realm was looking at biochemical imbalances. One of the first conferences I went to help with autism, they used to be called Defeat Autism Now, or DAN conferences. We learned about GI health and a number of things, but learning about biochemical imbalances from the folks at the Pfeiffer Treatment Center in Chicago, which is unfortunately no longer, was one of the things that really helped me. They said, we found that in kids on the spectrum, they have significant zinc deficiency. They have commonly high copper. They can have something called pyrrole disorder. And these were all new terms to me to some degree. But sure enough, when I started going back to my general practice and looking for these things, they were there. And even more interesting, as I started to intervene with these abnormalities, I was seeing improvement. So that was okay. And then eventually, we learned about GI health, and down the road, many other things. So now, I don't just treat kids with autism, we treat kids with PANS and PANDAS, pediatric acute onset neuropsychiatric syndrome, which is under-recognized, unfortunately. Chronic Lyme disease, acute Lyme disease can trigger that too. We also see problems with mold and mold toxicity, and any of the other, I would say, functional issues that can go on, chronic illnesses that go on in anybody in society. So, you come to see us, the goal is, okay, what are your symptoms? What does that really point to? What organ system, what organ systems? It's not one thing. Could be out of balance, or, and again, back to, what does the body need? What does it want? Can we find
in terms
that out?
of nutrients or
Nutrients,
detoxification and
detoxification, stress reduction, calming of the nervous system, talk therapy,
skill building, a sense of purpose in life.
all of those things that, when we use the listening program, a specific auditory program that helps the body deal with stress so much better. And in the kids with autism, it's actually improving cognitive function. I mean, I've seen kids that have significantly better language and significantly better socialization. And when I talk to families, that are kind of new to autism, I'm explaining that, one of the core deficits we see is this difficulty with social emotional connectedness and communication and imaginative play. And I explain that, these kids don't recognize that we're actually covering them with lots of language and cues about these things. They're just not able to see them or perceive them. So some of what we're doing is, let's open up their mind to something, to be aware to something they weren't aware before. And then that starts to restore development. I mean, there's just so many things to talk about, but that's just one of the ways I look at it, is what can we do to help any one individual be well,
So at what point did you get connected with the listening program?
Actually, that came on, I think, about 8 years ago now. So I corresponded with Alex Doman from Advanced Brain, and he told me about the listening program. And, I was, I'm overwhelmed with all the different options I have to me. And I'm like, that's nice. But in a really, I'm really interested in that. And we started using it, and I was just shocked, so that I have been trying to do, as I said, this idea where I'm helping the kids learn better and trying to make sure they're getting the right therapy. Are they getting a good occupational speech therapist? Do they have good behavioral therapy? Are we helping them achieve better in that case? And we added in the listening program, and the kids made significant gains. And, I had a 26-year-old young man with autism who was aggressive, sound sensitive, minimally verbal, very difficult for the family to manage. And within, 6 months to a year of TLP and doing all the biologic things we do, he eventually potty trained. Imagine that.
That's pretty impressive.
Yeah, exactly. And he's gone on from there. So sometimes.
So just so for our audience can track this, TLP stands for the listening program.
Yeah.
And Advanced Brain Technologies with Alex Doman is the creators of that, the listening program. And what this is essentially is, it's a subscription to a specific type of science-based sound that you listen to 2 or more times a day, and it stimulates the brain in different ways.
Right. Yeah. And one of my thoughts too is a core piece of the music of the listening program is the bone conducting headset. So it's vibratory, and that vibration transmits through the entire frame. And, our first experience with sound is in utero. is vibration. So I think that not only is it stimulating the brain from the auditory standpoint, bone and air conduction, but it's sending some other signal to the rest of the body that seems to be calming. I mean, I haven't done that research. That's just my theory, but it sure seems that way, because we've had kids that have PANDAS. So that is a person that has had typically an infection, and there's a post-infectious autoimmune response to that infection that triggers specific set of symptoms in the brain. And those are anxiety and or separation anxiety, OCD. You can have an abrupt change in academic skills, so end up with ADHD kind of symptoms. You can have physical tics. And I'm blanking on one more, but in any event.
Explosive anger.
Explosive anger, that's the one, yep. Getting them treated with the right medical treatment and integrative treatment can be helpful. But until their neurologic state really improves, they're still going to be stress intolerant. And one thing I think we've really seen is in a number of the kids, TLP helped return the brain to improve stress tolerance. So something separate from the autoimmune attack of the brain, but that autoimmune attack of the brain made them more sensitive to something that we've seen TLP help.
And the proposed mechanism for TLP helping the brain development is?
Well, that's the science for Alex and the rest to explain.
Yeah, it's just various levels of stimulation. There's binaural sound. There are specific tones that resonate different parts of the brain and stimulate either the hormones or the neurotransmitters.
Right. Yeah, you're giving the brain a specific stimulus it needs, in a certain way, and that's what the science of the sound is, to help develop reactive pathways or normal neural pathways that then go on to better function. It could be as simple as acoustic sensitivity, sound sensitivity, but it's far more than that. It's just not being able to tolerate sound. We need to process the sound, and so my daughter, unfortunately, is deaf in one ear post viral infection. And when we were first starting to treat her, we tried aids, but eventually it became clear that we could return her auditory sensitivity to normal, but she lost her word processing. So she was functionally deaf in that ear. And that was one of the first times I really understood that, it's not just sound, it's processing of language. It's the same thing, like dyslexia, it's not just, is the camera of the eye working? It's the visual cortex has to be able to translate that image into something that the brain understands. It's far more complex than an image.
And translate it consistently.
Right, exactly, yeah.
Yeah. So you've talked about how certain medical conditions can trigger what looks like mental wellness issues. Are there others that, aside from PANS or PANDAS, that you routinely see that have a base in either the gut health or imbalances with copper and zinc? Or
yeah, exactly. Again, a long list, but if I started with the biochemical imbalances, which I learned at Pfeiffer, we have zinc deficiency, which can affect memory and explosive anger and GI function and skin health. High copper, which tends to be pro-oxidant. And when you hear that word, you're talking about greater inflammation and greater problems with mitochondrial function. Mitochondria are their energy factories of the cell. We want those to work right. Those kids tend to be hyper and can be kind of explosive. The big one, and we talk about this in the practice as people come and work with us, is you can see chemistry, and this is the one you can see. So pyrrole disorder tends to be the stress intolerant, anxious, fearful, rageful person that's very sensitive to sound and other sensory abnormalities, sound, light, touch. And they also have misperception. So we're now starting to get into kind of metacognition, and they don't perceive the things around them as well. It's not full-blown full-blown paranoia, but they have kind of misperceptions like, I'm not irritable. Oh yeah, you are. You did that purposely to make me mad. No, I'm just a normal, messy human being, but that leads to significant problems. And then high and low histamine, those are a little harder to explain, but one tends to give you a person who's pretty driven and perfectionistic, and the other one who's very nurturing and kind and ready to help out. Not that these are absolute barriers, but the way I look at them is they give me, if I know their biochemistry challenges, then I probably also know some of their strengths and their weaknesses, and so why does this matter? Well, we had a kid just recently, one of my nurse practitioners saw, who was perceived to have PANS and tick-borne illness and mold illness, kind of a trifecta of things we see commonly. And on history, it really sounds like he had pyrrole disorder, and he was rageful and vengeful and many troubles. And it turns out within about a week or two of the right vitamins, he was happy. I mean, he changed. I mean, it was a 180.
Now, when you mention pyrrole disorder, how is that identified?
Well, it can be identified by a urine test. Getting that test has been harder as time goes. I think now that I've seen it so often, most of the time we do it clinically. When we see the constellation of symptoms, then we know. In fact, Lyme, for example, not to get on a tangent, but Lyme is a clinical diagnosis. Everybody's like, well, we got to have a blood test. Well, not necessarily, because the testing is so hard to be not falsely negative. But, we use something called the Horowitz MSID screening questionnaire to help us correlate a lot of different symptoms to give us a probability of Lyme disease. So I like as much as I can to make sure that the history we get is consistent with our diagnosis, consistent with our history. And then we use our labs to confirm our clinical suspicions with the history and evaluation.
So what is there, other than tick-borne illness, are there other ways people get Lyme?
Well, yeah, you can. It's typically tick bite, I would say, but you can get it in utero, so it can be passed to the fetus. And there is thought that it can be passed through intimate contact as well. One of the patients, and I guess when you're saying, what are we looking for? We had a patient who came in who was thought to have typical schizophrenia and was treated as such for about 3 years. Thankfully, the father was listening to the history and doing his internet research and said, well, I really think he has PANS and not schizophrenia, and asked us to evaluate him. And Dad was right. He had abrupt onset. So I mean, he just at 13 kind of had significant break, but it was associated with classic PANS symptoms such that we were like, well, is what we're seeing a hijacked brain or a primarily psychotic brain? And interestingly enough, also he had rash on his body that was consistent with a tick-borne illness called Bartonella. And Bartonella, turns out it causes psychosis. So it turns ultimately that this young man had PANS and Bartonella, and with treatment became normal. He's actually of genius intellect. We fortunately were able to, get that published so that others could say, okay, what else might it be? Because it wasn't schizophrenia, and in the acute onset of schizophrenia, the differential diagnosis is tick-borne illness. And again, if you're depending on tests that are of poor quality to make the diagnosis, then you may miss it. It's the history.
Good to know. So you talk about choosing mental wellness.
Yeah.
What are some of the things any of us could do to be choosing more mental wellness? Well,
we live in a pretty stressful world. And so stress is a killer in many ways. It's so as much as we can, we want to try to mitigate our stress, reduce our stress so that we're not overwhelmed and stressed. And that comes with healthy lifestyle. So are we getting adequate rest? Are we getting adequate exercise? Are we eating nourishing food, which is a whole other discussion in and of itself? Is it non-toxic? Is it non-allergic? What are we doing for mental rest or mental wellness? Friendship, family, focus, meditation, prayer. I'm sure you can help me on this because there's some things I probably missed, but really that's choosing to live in a healthy way.
Well, one of them that comes to mind that you didn't mention there is this idea of a sense of purpose in life.
Sure. Yeah, there you go. Yeah.
And there are a number of different ways to try and construct your own sense of purpose. It's unique to you, a sense of belonging to community, some sense of love in your life, however you want to define that, in combination with the things you were just listing.
Right. Well, I recognize that, I'm more on the medical side. And so as much as we can, we want to have people that work with a counselor or somebody to, psychologists if needed, to help make sure that they are learning those other things that they need to do.
It is a challenge for a lot of people that I work with to get them to say, okay, but, I don't have time for that. So when you stop and look at your life and you realize you don't have time to do the things that would make your life better, what are you filling your time with? And it ends up that it's a big set of choices and existential choices people have to make between continuing the things that they spend their time on that are not helping them, that are inducing stress or preventing them from getting decent exercise or rest, et cetera. And
sometimes people present to us ill because we can only tolerate so much so long. And I'm not on a high horse here. I have my trouble getting in adequate exercise. I try to eat right and make sure my weight's okay. But it ultimately will catch up to us if we lead an unhealthy lifestyle. And that's all things, as you said, friendships, purpose.
So are there some other case examples that you can give of people who benefited from this functional integrative approach?
Sure. Most of the kids with autism, we've probably seen over 5,000 now, do better. I'm not saying that they are fully recovered, though we do have some that lose their diagnosis, but, maybe about 5%. But in many cases, their life is much easier. They're more engaged in school and they're more engaged in their family. So I would say that almost any child with autism is worth, looking at that entire holistic approach to their health, because we might be able to actually have them speak, which makes their long-term care better. In the back of my mind in every first patient is, are they sleeping? Because if they're not sleeping, mom and dad aren't sleeping. So I try not to be too paternal, but there's certain things, having been through this, this time with my son, is, there's things we're looking for that actually help heal the entire family. Because autism and or mental illness, other things affect everybody. I mentioned the one young man, or the young man with autism. PANDAS is a really tough thing to live with. So I would say one of the hardest things is for parents to recognize what's happened, because in autism, most parents have some idea something isn't normal about their child for months before they are presented with the diagnosis. The classic onset of PANS is overnight. With a short period of time, they're not the same. Now they're rageful, the OCD, they can't leave the house. They won't, it's almost like the umbilical cord is reattached to mom. They may not eat. Their physical health and wellness is threatened. And so in that case, anytime we restore normalcy, we've really reduced the stress in the family. And that's the greater majority of the patients we see right now. And I would say the greater majority of those patients do much better. The majority remit. But as you start adding in other illnesses, PANS with a tick-borne illness or PANS with a mold illness, that becomes a longer journey to wellness. So one of my patients had been treated with so he had all of it: mold, tick-borne illness, PANDAS. He was on a track where his school district never changes track, never goes from lower functioning to higher functioning track. But with the things that we did with listening program, with detoxification, with hyperbaric oxygen, with the nutrient balances, they ultimately moved him to a faster track, which they had never done in their entire career in this school. And you can just see that he's more engaged. He was starting to care for all the people around him rather than being lost in his own world, so to speak, or hyper focused on his own needs. His true nature of nurturing came up.
So I have a number of people I've worked with over the years. The parents are just phenomenal, points for sainthood. They just keep plugging away. And occasionally I run into somebody and the parents come in and say, our big issue is this person is so sensitive to any change.
Yeah.
So even if they're doing homeopathic remedies, or they're doing vitamin supplement changes, or they're doing the tiniest change in a neuropsych med or a psychotropic med, they get violent reactions. Have you encountered that much? Is there some way to start talking about that, the blanket, to calm everything down kind of approach?
I don't know if I can say that there's any one thing that works for everybody. That, fortunately, those patients for us are fewer and far between, but they exist. And that's where it's, what do they really need? Now, unfortunately, it means that we probably have tried a few things and found them to be very reactive. So what we'll do is start stepping backwards. For example, some of the herbal remedies we use can be used on the skin. It reduces their potency so much that we might be able to start with a dermal version or a dermal dose and eventually go to oral, But that's a tough one. I mean, each one of those patients is so individualized. It's hard for me to give you a blanket answer.
And when they've gotten a problem like the autoimmune encephalopathy, every little change creates the inflammation, which creates another rage outburst or meltdown. Right. Or
I could say that, I've been pondering about, the approach to PANS, and, I'm not an expert, but we primarily are looking at the infection triggered part of the illness and the inflammation. So we're doing both. However, we really try to hone in what was the triggering infection or the triggering insult and address it. We also do the inflammation. And inflammation, if it wasn't for some of the turmeric and curcuminoid preparations that I use, we really wouldn't have the success we do. Because on the one side, we're treating infection, but we still have to calm down the auto-inflammatory component. And steroids, yes, are helpful, but they have a downside too. And then one could use IVIG, but that's, as we start getting into more aggressive therapy, we're getting into higher risk. So doing nutraceuticals, things that are turmeric or curcuminoids, we can use ibuprofen too. If we get rid of inflammatory foods, we use a specific supplement called SPM Active. That's a resolvent. So it actually resolves inflammation. So, and then restoring biochemical imbalances can help the immune system not be overreactive. So we need to try to get after the trigger, get after the inflammation as gentle as possible, and then up our ante as we need to. And usually we've had good success with that.
So with the turmeric and the curcumin that you administer, are they specific preparations from a pharmacy? Or these?
No, they're over-the-counter preparations. We use several different ones. I don't know if I already used one name, if that's okay. You know, we use Enhanza, we use something called Tariva. We use something called Inflammablocks. We just found that there's a chewable turmeric form from that we are going to try and see if it works. Part of the challenge is not all patients can take all forms. You know, being a pediatrician, we need to find liquids and or chewables. Otherwise, you know, you have to open caps or crush tabs and put them in stuff.
Yeah.
That's part of the challenge is also being able to make it palatable. If you like turmeric, great. If you don't, it's pretty strong.
Yeah. Well, so what, you know, if we think about winding this down, what's an area of your practice or life experience that we haven't even asked you about yet that you want to make sure we get in?
Well, you know, I would just say that as I think back over my career, I'm just very grateful that the Lord has called me to a ministry that I can help others. You know, if it was, I wouldn't be able to do what I do today if it wasn't for my son needing extra help. And if it wasn't for all the parents and other people that have taught me along the way and gratefully, you know, have trusted me to try things or asked me to try things, and I've trusted them and we've seen big improvements. You know, that's one of the biggest things, I guess I would say, is just thankful that I have a career to make a difference.
Do you do any as you know, most of the time when we have the lens to look at it, we see that whatever it is that we see as a trauma or tragedy has a brighter side to it. And one of those things would be this coronavirus and all the restrictions. It seems to have really opened up telehealth for a lot of people. Are you doing any more of seeing people that can't travel physically to where you are? And
that's really problematic because I can only do telehealth in a state that I'm licensed in. I'm licensed in Ohio. So we really need to see people in the office. So, however, people can, you know, we're set up because that's what we did at Pfeiffer, is to try to see people less often. So it's not like we're going to ask you to come back in 2 weeks. You know, we try to see our patients every 4 to 6 months and manage things by phone. The way I look at it is if we're seeing people compliantly according to the state and something goes amiss, we can handle it over the phone because we're planning to do, you know, what we're supposed to do, which is see people in the office. You know, what we do is not primary care. So when we give somebody a list of things to do, we try to make it so that, you know, they can take these individual steps and, you know, give us an update via, you know, a portal message or something along those lines.
so are you one of those providers that is so busy that you aren't taking new clients, new patients at this time?
Well, we haven't closed the practice. It's just how long do you want to wait? You know, I think my next first appointment is sometime in the early part of next year. But my nurse practitioners both have appointments available this year. My newest, Nick, is quite good. Since he's only been with us a year, he has appointments within weeks. And I have to say, both my nurse practitioners care for my family. So I have the utmost trust in them. People don't need to see me to get good care here. I learn as much from my nurse practitioners as I hope that they've learned from me. You know.
So what do you have a series of terms or qualifications or trainings that you recommend people search for if they're trying to find somebody? They can't get in to see you,
Yeah.
but they're trying to find somebody that is of a similar mindset and approach?
I would say I'm a little bit of a hodgepodge of several things, but the Institute of Functional Medicine, which I'm currently doing my certification, I think is really a fantastic basic program. There's other people use something called A4M. That's a little different than what we do. And then Dr. Walsh, who founded the Pfeiffer Treatment Center, has a training program through the Walsh Research Institute that kind of talks about the biochemical imbalances. So I think biochemistry is very helpful in my mind, not as well accepted by some of integrative colleagues. But functional medicine covers pretty much all the biology things that I talked about, and is really looking at, lifestyle kind of medicine. So those are two big things. I have books that I recommend to people because under stress with the video, I wrote it down so that I don't forget. I think probably one of the best books for people to read is called Healing is Possible by Neil Nathan. It's really good.
Can you say the last name again?
Neil Nathan.
Nathan.
Yeah. And he also wrote a book, Toxic, which for me, as my current patient population, is essential for when he told me he was going to write it and I read it, I was like, boy, this is the answered prayer for trying to help understand the complexity of all these different illnesses at once. The other one I like is How Can I Get Better? That's by Dr. Richard Horowitz. It's about Lyme and tick-borne illness. Nutrition and Mental Illness by Carl Pfeiffer was kind of the inception of the Pfeiffer Treatment Center. That's how it had its name, Carl Pfeiffer. And then for mold illness is Break the Mold by Jill Krista. And then my wife's a spiritual director, so we look at spiritual healing and forgiveness. And probably one of the most profound books in that category is called Unbound by Neil Lozano.
Neil Lozano?
Lozano. Mm-hmm.
Unbound by Neil Lozano. Wonderful.
Yeah, it's truly revolutionary when you think of emotional healing and forgiveness.
Well, that's great to hear. There are more and more people doing things like that. The Journey's Dream Group has gotten access to, has been developing, some of its founders have been developing the Optimal Being program.
Oh, wow.
Which is right in line with that. It's, I would use the same words to describe it as you just used to describe Unbound.
Really? Okay. Well, I want to find out about that too.
It's very, very solid, practical, effective, efficient tools for improving the quality of your life and relationships. And people can find out more about that on journeysdream.org. And I greatly appreciate your willingness to share with us and sharing the resources. And I look forward to reading a couple of those books you mentioned and following your work.
Thank you very much. And I'll be looking up
the Optimal Being program. Yeah.
Optimal Being program. Thank you. Yep.
All right. Well, blessings.
Thank you. You too.
Dr. Alan Lewis, MD, has over 30 years of medical practice experience using both traditional and integrative medicine approaches. He is the founder of the Sancta Familia Center for Integrative Medicine in 2011 in Columbus, Ohio. There, he specializes in treating children and adults with learning, mood, developmental, behavioral, and immune infectious disorders, including autism spectrum disorder, attention deficit disorder with and without hyperactivity, PANDAS, and Lyme disease. Dr. Lewis was also recently named the clinical director for the Advanced Brain Technologies founders and creators of the Listening program. His medical career was directed down a different path when his child was diagnosed with autism at age 2. Without a functional framework in traditional medicine for treatment of child's autism and associated medical problems, Dr. Lewis began to explore integrative, holistic, and functional medicine therapies. Dietary intervention, targeted nutrient supplementation, and approaching treatment with a more integrative functional framework proved to be effective in helping his child, as well as many of his patients. In response to seeing such profound effects with these treatments, Dr. Lewis continued to explore other integrative modalities and was certified by the American Board of Integrative Holistic Medicine in 2002 and recertified in 2010.
You've been listening to the On Your Mind podcast, offered by Journey's Dream, where we support people through mental health challenges to a place of true and lasting well-being. If you love our show, we invite you to visit onyourmindpodcast.org to join the conversation, access the show notes, and discover our helpful resources. Thank you for listening.